The choice between a mechanical and a bioprosthetic valve is increasingly viewed through the lens of lifetime management, shifting away from a simple age-based binary towards a more nuanced assessment of patient longevity, lifestyle, and the feasibility of future interventions. Current guidelines emphasize shared decision making, but several objective clinical pillars remain central to the selection process. Mechanical valves are generally favored when durability is the primary concern and the patient can safely manage long-term anticoagulation. Durability of mechanical prosthesis is virtually lifelong. The risk of structural valve deterioration is negligible. Anticoagulation requires lifelong vitamin K antagonists, usually with a target INR of 2 to 3 for aortic positions and 2.5 to 3.5 for mitral positions. Ideal candidate: patient aged less than 50 for aortic or less than 55 for mitral. Patients already on anticoagulation for other reasons like atrial fibrillation. Patients with a high risk of rapid bioprosthetic calcification like end-stage renal disease or hyperparathyroidism. According to a comparative study published in NEGM in 2017, long-term mortality benefit associated with the mechanical processes as compared with the biologic processes persisted until 70 years of age among patients undergoing mitral valve replacement and until 55 years of age among those undergoing aortic valve replacement. Bioprosthetic valves are selected to avoid the lifestyle constraints and bleeding risks associated with warfarin, acknowledging that a re-intervention will likely be necessary. Durability limited by structural valve degeneration, which can typically occur 10 to 15 years post-implantation, though newer generation valves may offer improved longevity. Anticoagulation only required for the first 3 to 6 months post-operatively, aspirin or vitamin K antagonists, unless other indications exist. Ideal candidate: patients aged more than 65 to 70 years. Patients with contraindications to long-term anticoagulation or high bleeding risk. Women planning pregnancy